Cardiac catheterization, angioplasty, stent, these are medical terms you may have heard about. But do you really know what they are? You should. One day, they will save your life. Taking the fear out of the heart catheterization. That is today on Time Waits for No One.
From Mercy St. Vincent Medical Center's Cath Lab, this is Time Waits for No One with Dr. Ameer Kabour, Chief Cardiologist and President of Toledo Cardiology Consultants. This is Time Waits for No One. Today, cardiac catheterization and angioplasty, medical procedures you will likely experience during your life. What are they? Why are they important? And what you can expect when your doctor says we're sending you to the cath lab. Today on Time Waits for No One, sponsored by Minx.
Welcome back. Now we are going to show you some exciting animation showing step-by-step the heart catheterization process, the heart disease process, so you will have a better understanding about everything we want you to know. The heart's main function is to pump blood to the rest of the body. To do this, it needs oxygen and nutrition for energy, just like other muscles. So it's important that the coronary arteries that bring blood to the heart muscle are not blocked. If you look into the arteries right now and try to understand the blockages buildup, and we always talk and educate you about the necessity of diet and exercise. So try to understand how is the blockages buildup. As you can see on the screen, the arteries are wide open and the blood is running very smoothly. There is some yellow particles, which is the bad cholesterol, and the red one are the platelet and red blood cells. And there is also a smaller brownish particle, which is really the good cholesterol. There's always a competition between the good and the bad cholesterol, leading to the future management of the heart disease. We want the bad cholesterol to be as low as possible, and we want the good cholesterol as high as possible. Why? Because the bad cholesterol, as you can see on the screen, it starts showing the buildup of the plaque, which is going to lead to a significant blockages. As you can see, the cholesterol LDL, the bad particles, start going inside the wall of the artery, and that will be the problem on the long run. Over the years, if you are a smoker, diabetic, high cholesterol, obese, all of that, you have a gene problem and your family, strong family history of coronary disease, you build up the plaque, and then you start having the platelet accumulating on top of that and building up a significant clot, could lead to a massive heart attack. As you can see on the screen, the clot growing and growing, and the plaque is building up more and more, and then that's when you have the heart attack. A cardiac catheterization, or heart cath, is a diagnostic procedure that provides a picture of the blood vessels of the heart by using X-ray dye and fluoroscopy, a type of X-ray movie. These blood vessels, called coronary arteries, supply the heart with oxygen and nutrition. Coronary artery disease, heart valve disease, heart failure, and congenital heart disease are some of the problems that can be diagnosed with a cardiac catheterization. To start the heart catheterization, a numbing medication will be given before the catheter is inserted in the groin area or in your arm area, depending on which procedure we are using. The catheter will be guided to the heart. Once it's in place, dye will be injected into the coronary arteries. Your doctor can see any blockage as the dye moves through these arteries. A series of X-rays images will be made using a circular X-ray tube and rotate around your body. The doctor will view these images on a TV-like monitor in front of him. Some people feel a flushing sensation during the procedure, metallic taste, headache. All of these could be a side effect of the dye injected in your heart. Now let me show you how is that done. As you can see on the monitor here, the heart catheterization is started with the sheath, and then the catheter introduced into that sheath, pushed into the femoral artery, going into the aorta, and then after that we reach to the heart, as you can see it in a second, where we engaging with the main arteries of the heart, and we start injecting the dye to identify the blockages in those arteries. As you can see on the screen, after we inject the dye in the arteries of the heart, we identify the blockages as you can see it. That blockage is a significant one, leading to abnormal stress tests, leading to the angina symptoms or chest pain, trouble breathing, all of those symptoms which could happen in coronary artery disease. During the heart catheterization, if we decide to treat this problem, usually we start by doing what we call a balloon angioplasty. As you can see in that animation, it's showing that the balloon put in the blocked area, and then after that we go through the wire, the same wire we advance the balloon, we go ahead and we put the stent as you can see it in the screen. So the 3 steps of the management is to identify the blockage, treat it with the balloon first, and then after that with the stent, using a specific anticoagulation to make your blood thin enough during the procedure to have a better outcome on the long run. A pressure or a closure device may be used to seal the artery to prevent bleeding after taking out the catheter. You would be encouraged to drink water and other fluid to help flush the dye from your body. Generally, you will be asked to be flat on your back for about 2 hours if you receive the closure device and about 8 hours if you receive the pressure manipulation of pulling out the catheter. Your doctor will describe the risk associated with the cardiac catheterization as it's shown on the screen. Possible risk may include bleeding, infection, damage to the blood vessel at the catheter insertion site, heart rhythm disturbances, chest pain. Stroke may also occur but are very uncommon. There may be other risks depending on your specific medical condition, and your doctor will explain it to you at the time. So physically, after we did that angioplasty stent, how do you feel?
I feel like a new man. I feel totally fine, like nothing's ever been wrong with me.
Ready to go and enjoy your life again?
Yes,
Good.
again.
Peer pressure makes it easy to start smoking and much more difficult to quit. It wasn't until I saw the results of smoking in some of my dad's young patients that it scared me enough to quit. Be smart and quit today.
This is the truth about cigarettes. They are loaded with harmful chemicals, and the end result, they are a dangerous drug that can seriously harm all people, regardless of age.
Go to ToledoNewsNow.com and click on Toledo Cardiology Consultants.
Because time waits for no one. Heart catheterization has 2 approaches. The first one is radial and the second one is femoral. The radial approach is gaining popularity lately. The advantage of using that approach is easier to be used with patients with vascular problem and patients who are overweight. This approach will shorten the mean time to achieve recovery, allow immediate ambulation, increase patient comfort and satisfaction, decrease hospital stay, and it's safe and effective modality. The disadvantage, on the other hand, physicians require longer time to learn the procedure and become more experienced, so the learning curve is longer. Also, the patient and physician has a higher exposure to radiation in comparison to normal. On the other hand, femoral approach, which is used in 90% of the cases in the United States for heart catheterization, is becoming very efficient and very successful because of less complication and very successful rate. That's because of the closure device. This one used to shorten the mean time to stop bleeding at entry sites within a few minutes, and shorten the mean time to ambulation, where most of the patients start walking within 1 hour and go home within 2 hours. Increase the patient comfort and satisfaction, decrease hospital stay, safe and effective modality. These closure devices has different kinds. The older generation called intravascular devices. It used sutures or collagen plug. Close the hole well, but not as good as the vascular entry hole. And it leave a closure component at the entry site, as you can see it with the arrow pointing to that area of the closure device component. It still caused some pain when it applied in the groin. Saying that, technology advanced and came out with the extravascular devices, the most advanced closure devices, and minx is one of them. Use material dissolved within 30 days. These materials apply to the outside of the arteries. No component left behind. Almost no discomfort when applied to the groin. So remember, ask your cardiologist about the closure device he is going to use for your own comfort.
The Minx Grip Vascular Closure Device from Access Closure. The Minx Grip Vascular Closure Device offers an active, extravascular, patient-friendly closure solution that enables durable hemostasis without sutures or implants. The Minx Grip sealant is delivered through the existing procedural sheath, eliminating vessel trauma that is often caused by sheath exchange and tissue tract expansion. Temporary hemostasis is achieved first by placing an intra-arterial balloon, followed immediately by delivery of the Minx Grip sealant, which is positioned on the surface of the artery. After delivery, the Minx Grip sealant is compressed, accelerating expansion and adhesion to the vessel wall. The grip tip consists of two PEG components. Once the grip tip enters the tissue tract, the body's temperature and pH level causes these two PEG components to react and cross-link. As the cross-linking occurs, the grip tip softens and interlocks with the contours of the vessel wall, effectively gripping the artery and providing active closure. After the initial sealant expansion, the balloon is deflated and the device is removed. Platelets and blood cells continue to collect inside the Minx sealant's porous matrix, causing the sealant to swell 3 to 4 times its original size. Together, the Minx sealant and the grip tip produce a durable hemostasis and a platform for natural vessel healing. The sealant dissolves naturally through hydrolysis. Within 30 days, the sealant is completely reabsorbed, leaving nothing behind but a healed artery. Minx Grip grips on contact and leaves without a trace. Minx Grip is an active, extravascular, patient-friendly vascular closure device.
Heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
Getting men to change their lifestyle is leaving their wives and children very frustrated. Men seem to think that medication is a fix. It's like putting medications in the big cheeseburger and expecting to be healthy. Come on, guys, you can do it one step at a time.
To learn more, go to WTOL.com Health Track.
Because time waits for no one. So here we have Joe finished his procedure, had his heart catheterization, and we're going to ask him a few questions because, as we mentioned earlier, we want that fear about the heart catheterization to go away from the people. So Joe is just an example, and it's a real patient who is going to tell you his experience about how did the procedure go. Hi, Joe.
Hi.
So you had your heart cath.
Yes, I did.
I'm going to let you speak and tell us exactly how was it and how is everything went.
Okay, I came into the cath lab and there was 4 or 5 ladies that asked me a whole bunch of questions, slid me over on the bed, and the one lady told me, I'm going to give you something to relax you, and which it did. It relaxed me. And as I was laying there, I was getting relaxed, and then you came in and did the heart cath. And then after you did the heart cath, I laid there for a few more minutes, and they They unhooked me and they took me out, and it probably lasted a half hour or less.
Did you have any chest pain during the procedure, any major symptoms?
No, I didn't feel a thing.
Because heart catheterization, when we do an angioplasty, the patient could experience some symptoms during the procedure. So we always ask the patient, how does he feel? Is there any chest pain, trouble breathing, confusion? We ask them sometimes to move their arms and their hands to be sure that they are not having any major complication from this procedure. So Joe, after he had the heart catheterization, we made a determination that he has a few blockages and he is going to require a stent. So did we talk to you, Joe, and told you that you're going to have a stent?
Yes, I was.
And you were already consented for that, that if there's
Right.
any blockages, we're going to proceed with a
The
stent,
minx
right?
grip vascular closure device from Access Closure.
Yes, yes.
Now, after we are done, did we do any, I mean, did we put a sandbag on your groin and we told you you're going to stay
No,
lying down?
You put a plug in my groin, and then I went out to recovery, and they gave me some meds, and then I went back up to my room.
So within 1 hour, you're done.
Yeah.
You are able to walk and you're feeling good, no problem, no bleeding, no.
Nope,
This is
nothing.
the advancement in the heart catheterization. Most of the patients, they used to be lying down on their back for about 8 to 10 hours. And it's really depends on how much pressure we put on the groin, and the complication of hematomas and bleeding was much higher than what we have these days with using these plugs, which is a simple procedure. We use it in most of the interventional procedure, and Joe is one of the example. The reason we are concerned about that because of the blood thinner. You know, when we do an angioplasty stent, we use a blood thinner, and that's one of the example here for Joe. Joe, how you feel right now about going home?
Great.
Good.
I'm ready to go. I've been ready.
Now, was it the procedure that fearful, that complicated? Were you concerned about it?
No.
Is that because you had it before? Was it like the first time, or it was a little
No.
bit different?
Because even the first time I had it, I wasn't too concerned about it.
Good.
Because I knew I was in great hands, so it made me feel good.
But other than being in great hand, is it because we informed you about what to expect and you got enough information about the
Yes.
procedure?
Yeah, everybody explained the procedure very well to me.
Good. And that's really our goal, is to educate everybody about heart catheterization and how we're going to do it, and to get that fear out of your mind.